Earlier today, our continent celebrated the 30th anniversary of the American division and the freedom that we have all attained as separate nations. Blue Columbia and the Republic of Texas lit rare fireworks displays, while the ATHOX Union and the States of America, the former U.S., continued to battle along the Savannah River. As of 20 hours, parades have ended in the capital. And a reminder, the curfew that has been lifted for the occasions will resume tonight at 21 hours. But now, here with us tonight via special clearance telecommunications is Theodore O'Donnell, Executive Branch Government, ready to discuss the recent outbreak of an illness in 9 southern districts. Good evening, Mr. O'Donnell. How do you think the government will react to the situation?
Yes, good evening. I believe this is just a repeat of the District 32 incident. We will evacuate the sick to quarantine hospitals and the remaining population to other districts.
Can this turn into a large-scale problem?
Yes, but only if the population does not cooperate.
How will the infected districts be rehabilitated as far as cleansing?
If the outbreak is small, we can disinfect the region with what little we have. However, if the events escalate, the government will nuke the districts with minimal damage warheads.
If, as you say, the situation becomes hazardous, is there a chance that nuking will once again create a lake as in the District 32 cleaning?
Given the region, there is a mild chance. The District 32 incident was special because, given its proximity to Lake Michigan, the cleansing created a 6th Great Lake, Logos, which historically changed the Great Lakes acronym from homes to homes.
Thank you, Mr. O'Donnell, for your time, but we have received a notification of a government PSA in the next 10 minutes. Citizens, we would like to remind you that viewing is mandatory. In the next 5 minutes, several parts of the country may lose power as the electricity supply is redirected to power every television connected to the NGAS. Your broadcast may be delayed from the capital by as much as 2 minutes. However, safety measures are in place to guarantee your ability to watch the entirety of the announcement. With grain we shall sustain. Good night. Start of transmission. Government Public Service Announcement 15 of the year 2054. In recent weeks, the disease has been infecting several southern districts. Now the illness has been identified as RMSF, or Rocky Mountain Spotted Fever. The estimated severity of the threat is 2 out of 5. Predicted regions of risk are compiled through data from the year 2010. Hazardous areas include Central and Eastern North America, and small clustered regions in Central and South America. The following CGR districts are affected: Rocky Mountain Spotted Fever is transmitted as bacteria through airborne ticks, such as the American dog tick, Rocky Mountain wood tick, and the brown dog tick. Rocky Mountain Spotted Fever is not contagious. While RMSF symptoms mimic many other illnesses, early symptoms include fever, headache, abdominal pain, red eyes, vomiting, and after 2 days, a rash of small pink flat dots on soles, limbs, and palms that will not develop for 1/3 of ill persons. Rocky Mountain Spotted Fever may also contain later symptoms such as cough and diarrhea, often causing misdiagnosis. After time, a long delay in treatment may cause a severe symptom called petechiae, the breaking of capillary vessels. It is important for infected or suspected infected citizens to come to hospitals immediately, because treatment of RMSF in the first 5 days may determine survival or death. This essential early treatment means long antibody laboratory tests will be ineffective. A quick diagnosis of medical history, exposure to tall grass or chick-perfused zones, and medical intuition will be performed. At hospitals, the sick will receive doxycycline or tetracycline, the first line of treatment, which is most effective in the first days of infection. If the patient is pregnant, another dedicated RMSF antibiotic, chloramphenicol, will be used. Chloramphenicol has, however, shown a correlation with higher fatality. No long-term treatments exist. Expected doxycycline amounts are shown: 100 milligrams per 12 hours for adults, and 2.2 milligrams per kilogram for children under 45 kilograms. Normal antibiotics are not encouraged because they will either worsen or not affect the illness. RMSF bacteria travel in small clusters, while targeting the endothelial cells lining blood vessels. Vasculitis and loss of fluid may occur. Limbs can be disconnected from blood flow, and after about 2 weeks will need to be amputated. A sick person having symptoms can be, with treatment between 7 to 14 days, cured between weeks and months, while retaining a regular length lifespan. Sicker individuals with elevated symptoms, such as petechiae, have a smaller chance of surviving, face lifetime care, long-term effects such as neurological deficits, and organ damage. 3% of all persons infected with RMSF will die. Citizens classified rank C.2 researchers note the following information. The scientific name of RMSF-causing bacteria is Rickettsia rickettsii. Domain, bacteria. Kingdom, prokaryote. Phylum, Proteobacteria. Class, Alpha-probacteria. Order, Rickettsiales. Family, Rickettsiaceae. Genus, Rickettsia. Species, Rickettsii. Prevention includes wearing light, long-sleeve clothing so darker ticks can be more easily spotted. An additional precaution is tucking in clothes and using insect repellent. Removal of ticks should be completed using tweezers, and bitten area should be washed with soap and warm water. Antibiotics given after a tick bite will not prevent RMSF. While less than 1% of ticks carry RMSF, it is still important to be cautious. End of transmission.